right, get ready to dive deep. Today it's all about obstetrics. You guys sent in a ton of stuff, chapters, diagrams. Wow, someone's about to be a parent or is just super into this whole process.
Yeah, it looks like you want the whole journey from those first, wait, really, moments, all the way to postpartum care. Think of this as your crash course in, well, everything, baby.
I love it. So first things first, how do you even know you're pregnant? We've got the classics here, missed period, maybe some nausea, but I'm also seeing terms I've never heard of.
Right, you've got your classic morning sickness, which, fun fact, isn't always in the morning. But there's things like Chadwick's sign. Believe it or not, because of increased blood flow, the vagina and cervix can actually change color early in pregnancy. Pretty wild, huh?
Wait, color change. That's not something you hear every day. See, this is why I love these deep dives. Always learning something new. Okay, so maybe you've got a hunch at this point. How do you confirm and figure out that due date?
Well, the good old pregnancy test is the first step. But once that's positive, doctors often use Nagel's rule for that initial estimate. It's actually pretty simple. Take the first day of your last period, add 7 days, subtract 3 months, and add a year.
That is surprisingly straightforward math.
Yeah.
But I'm guessing ultrasound and other factors come into play later on for a more accurate due date.
You got it. Technology definitely helps refine things. Speaking of which, you also sent in a whole schedule of prenatal visits. Looks pretty intense.
Yeah, page after page of appointments, tests, screenings. It can feel a bit overwhelming, especially for first-timers. Can we break down why all of this is necessary?
For sure. The main goal is to monitor both your health and the baby's development. It starts with regular checkups, maybe every 4 to 6 weeks initially, but they get more frequent as things progress. We're talking blood pressure checks, weight measurements, listening to that tiny heartbeat.
Ah, yes, the magical heartbeat moment. You even included different ways to monitor it, not just the basic Doppler.
Right. Later on, there are things like the non-stress test and the biophysical profile. The first checks if the baby's heart rate accelerates when they move, a good sign. The second is more of a whole body assessment, looking at breathing, movement, muscle tone, even amniotic fluid levels.
Wow, it's amazing what they can tell from outside the womb these days.
Yeah.
Okay, but you also sent over this kind of scary-looking table of lab tests and screenings. I'm having flashbacks to biology exams.
No worries, we'll break it down. Each test has a purpose, even if it seems random at first. For example, blood type and Rh factor are super important because if you're Rh negative and the baby is positive, there could be compatibility issues. But the good news is it's easily treatable with medication.
Okay, that makes sense. What about this random glucose test I see here? Is that for gestational diabetes?
Bingo. It's sadly becoming more and more common. This test usually happens early on, and if it's high, there are follow-up tests to confirm the diagnosis and manage it properly.
So many tests, but it sounds like they all have a vital purpose. Clearly, a lot is happening even before the baby arrives.
Absolutely. And speaking of a lot happening, we haven't even touched on how your body physically changes to make room for this little human.
Yeah.
You sent a diagram of uterine growth, which is pretty mind-blowing.
Oh, yeah, that diagram. It's crazy how much the uterus expands and how the baby's position changes throughout the pregnancy.
Right, and it's not just about size. We're talking milestones, like feeling those first little movements. It's called quickening. And it usually happens around 18 to 20 weeks for first-time moms. It's a pretty amazing feeling.
Definitely one I'm looking forward to. So we've covered the basics, the initial tests, the incredible transformation of the body. But what about when things don't go as planned? You included some info on pregnancy complications, too.
True, complications can happen, and while they're thankfully rare, it's good to be aware of them. You know what they say, knowledge is power. You highlighted things like ectopic pregnancy, spontaneous abortion, gestational diabetes, preeclampsia. They all have their own causes, symptoms, and thankfully, treatments.
It's a lot to take in, but important nonetheless. One that stood out to me was multiple gestations. I had no idea the rate of twins in the U.S. is actually increasing.
It is, and multiple pregnancies definitely come with their own set of considerations. More intense symptoms, increased risks like preterm labor, but we can get into the specifics of that a bit later.
Sounds good. So we've gone from am I pregnant to a detailed look at those early stages, including some potential bumps in the road. Where should we head next on this obstetrics adventure?
Well, I'm thinking you're probably curious about the main event, labor and delivery. Let's break down those stages next, from those first contractions all the way to welcoming that little one into the world. Welcome back to our obstetrics deep dive. We covered a lot of ground in part 1, but now it's time to tackle the main event, labor and delivery. You ready to learn about the incredible process of bringing a new life into the world?
Oh, absolutely. I mean, this is the part everyone talks about, but there's still so much mystery around it. So, like, what even is a contraction? What does it actually feel like?
Great question. A contraction is basically when the muscles of the uterus tighten and shorten. You can kind of think of it like a really strong wave that helps open up the cervix and move the baby down the birth canal.
So it's like the driving force behind labor, I get it. But how would you describe the actual sensation? Is it like really bad period cramps, or is there more to it?
It's honestly different for everyone. Some people say it's like a tightening or cramping feeling in the lower abdomen that can go into your back. Others say it's more of a wave-like pressure that builds up and then eases off.
Okay, interesting. I'm also seeing a lot here about different phases of labor. Can we break those down a little?
Totally. Labor is usually divided into 3 stages. The first is the longest, and it's all about that gradual opening of the cervix, which is called dilation. Now, this stage is broken down even further into early labor, active labor, and transition.
Gotcha. What happens during each of those? It sounds like it slowly gets more intense.
Exactly. Early labor is kind of the wild card. Contractions are milder and less regular. You might have some cramping, maybe some backache. But that's your cervix starting to do its thing, dilating and thinning out, which is called effacement. And then comes active labor. Things get a bit more serious here. Contractions are stronger, they're more regular and closer together. And your cervix dilates more quickly now, usually going from about 6 centimeters to a full 10.
And transition. That sounds like where it gets really real.
You got it. Transition, it's the shortest, but often the most challenging phase. Your contractions are super strong and so close together. You might even feel that urge to push. It's your body basically saying, okay, almost time for showtime.
So like the final push, literally.
Yeah.
And then that takes us to the second stage of labor, the actual pushing stage, right?
Right. This is when you're actively working with your contractions to bring your baby into the world. It can take a bit, especially for first-timers, but it's a really powerful and empowering experience.
I can only imagine. And then we have that final stage, delivery of the placenta.
Yep, the grand finale. It
Yeah.
usually happens within 30 minutes or so after the baby is born. It's usually pretty quick and painless.
Okay, good to know. We've got the stages down, but let's talk pain management. I'm seeing a lot about epidurals here. What other options are out there?
Pain management is so personal, and there are quite a few different approaches. Epidurals, which involve an injection of anesthetic near your spinal cord, those are really good at relieving pain, but you're still awake and alert.
That sounds good for some people. What about for those who want to go a little less interventionist?
Oh, yeah. There are options like nitrous oxide. You might know it as laughing gas. It can really help you relax and manage the pain. Some people find comfort in moving around, practicing their breathing techniques, or even being in water during labor. It's all about finding what works best for you, for your birth plan.
It's so good to have choices. Now, what about when things don't go exactly according to plan? You mentioned complications before, but what about issues specifically during labor and delivery?
Right, sometimes labor doesn't move along like we expect. It's called failure to progress, and it can be because of the baby's position, the cervix not opening enough, or a bunch of other factors. Sometimes doctors will suggest things like pitocin, which is a synthetic version of the hormone oxytocin. It basically helps make contractions stronger.
And what about a cesarean section or a C-section? When does that become necessary?
A C-section is a surgical procedure where doctors deliver the baby through incisions in the abdomen and uterus. It's generally safe, but usually it's reserved for situations where a vaginal birth might be too risky for either mom or baby.
Okay, so what are some of the most common reasons for a C-section?
Lots of reasons.
Hmm.
Could be that the baby is in distress, or maybe labor is not progressing even after trying other things. Sometimes the baby is breech, which means their feet or bottom are down instead of their head, and that can make vaginal birth tricky or even dangerous.
So it's good to have that option when it's needed. But in the end, whether it's vaginal or a cesarean, the goal is the same, a healthy baby and a healthy mom.
Absolutely. And speaking of health, the journey doesn't stop when the baby's born. There's a whole new chapter, the postpartum period. We'll explore that next, from physical recovery to emotional adjustments and everything in between.
Okay, we're back for the last part of our obstetrics deep dive, the postpartum period. I gotta say, I'm already feeling a little overwhelmed with all this info, and we haven't even gotten to this part yet.
Yeah, the postpartum period definitely gets overlooked sometimes, but it's just as important as pregnancy and labor. It's a time of massive change, physically, emotionally, even just like logistically as you figure out life with a newborn.
So let's start with those physical changes. I'm seeing terms here like lochia, involution,
Mm.
even hair loss. Yikes. What exactly should new moms expect?
Well, your body's basically run a marathon, so yeah, there's definitely some recovery time. Lochia, that vaginal discharge after birth, it's basically your body cleaning house, getting rid of extra blood and tissue. It starts off heavy and bright red, but it slowly gets lighter over a few weeks.
And what about this involution thing? It sounds kind of scary.
It's just the fancy term for your uterus shrinking back down to its normal size. It takes a few weeks, and you might feel some after pains. They're basically mild contractions that help with the process.
So a lot going on physically. But what about the emotional and psychological side of things?
Yeah.
I'm seeing info on the baby blues and postpartum depression. How can you tell the difference between like normal ups and downs and something more serious?
The baby blues are really common. Think mood swings, feeling tearful, maybe some anxiety. It's all those hormones going crazy. It usually passes within a week or two. Postpartum depression, though, that's more intense and lasts longer. It's so important to reach out for help if you're feeling super overwhelmed, hopeless, or if you're having trouble bonding with the baby.
And this is where those postpartum checkups are so crucial, right? Not just for the baby's health, but for the mom's mental and emotional well-being too.
Exactly. Your doctor's going to check how you're healing physically, screen for any complications, and also connect you with resources for mental health support. It's a good time to ask questions, share what you're going through, and get the support you need.
Speaking of support, I'm also seeing a ton of information about breastfeeding. It's like a whole other world to figure out.
It can be, yeah. Breastfeeding is totally natural, but it doesn't always come easy. You might have latch issues, sore nipples, problems with milk supply. But the good news is lactation consultants are awesome. They can help with positioning, show you the best latch techniques, and just provide overall support.
And what about for those who choose not to breastfeed or can't for medical reasons?
Formula feeding is totally fine. The most important thing is that your baby's getting fed and growing well. Your doctor can help you choose the right formula and show you how to feed your baby correctly.
So it really is about finding what works for each family, right?
Okay, before we wrap up, let's touch on those postpartum complications you mentioned earlier, postpartum hemorrhage and endometritis. Right, these are serious, but thankfully not that common. Postpartum hemorrhage is basically excessive bleeding after delivery, and it can happen for a few different reasons. It needs to be treated right away to get the bleeding under control. Endometritis is an infection in the lining of the uterus. You might notice a fever, pain in your abdomen, and unusual discharge.
So knowing the signs is key. Seems like there's a lot to watch out for even after the baby's born.
That's true, but try not to let it overshadow all the amazingness of this time. The postpartum period is also about healing, recovering, and bonding with your new little one. It's a roller coaster of emotions and experiences, but it's ultimately such a transformative chapter.
You've really given us a complete picture of this whole journey, from those first exciting signs all the way to the sometimes messy but also beautiful reality of postpartum life. This has been an eye-opening deep dive for sure.
I hope it's been empowering, too. The more you know and understand, the more prepared you are for this incredible adventure.
I couldn't agree more. Well, that wraps up our obstetrics deep dive. But as we sign off, I want you to consider this. Knowing all we now know about how complex and amazing this whole process is, how can we better support and empower those who are about to start their own journeys into parenthood? Thanks for listening, everyone.